So good morning. My name is Christie Zelnik. I'm the lead speech and language pathologist and owner at Absolute Synergy Rehabilitation in Granite Bay, California. So I'm just gonna start bringing out some toys and talking to you about them. Super simple, right? Inexpensive toy that you can get on Amazon pretty easily. What's nice is that it has all the different colors, obviously. It also has the numbers on them. It also has shapes on them. And keep the toys away from the kiddos so that they don't have easy access. So perhaps if I put this one down first, I could say my turn, and then with wait, right? Provide the opportunity for the child to say something back. He or she might say then my turn, or I might gently take their hand and put it to their chest and say my turn, and then give them the next piece of the toy and go back and forth, right? All right, so this is another really super simple toy that you can get on Amazon that I like a lot. And keep in mind that especially if you're doing early intervention as a speech and language pathologist or speech and language pathology assistant, or if you're a parent playing with your child, especially if they're a kiddo who's kind of what Hannon would call an own agenda kiddo, so a kiddo who kind of likes to play a little bit more independently. If they have access already to all of the toys, they're not necessarily going to be particularly interested in you. They can request a turn, they can request a color. So you could say, green please, or if the child is at the place where they're only saying one word. So if he just says blue, then I would model blue please. I would expand on his utterance, make it a little bit longer. And then once he has it, and he opens it, get very excited about whatever it might be. In this case, it's a truck. The child already has the word truck. Then I could say blue truck and encourage them to try to say that again. So these are Buddy Bear WH question books. Isn't necessary, to purchase, speech materials. As soon as it becomes something used by a medical professional, suddenly it becomes very expensive. But certainly you could, if you like to. The age range that they mentioned for this is 3 through 7, but certainly you could use it with a younger child if they're already using WH questions or answering WH questions. And certainly you could use them with older children as well if they're still working on it. What I like about this book, or these books, is that you can take these out. They don't always stick super well. That's maybe my only con that I've noticed. But it asks, what is Buddy Bear playing? You or the child can put the ball in, wait, right? Give them some time to think about it. And then the answer would be ball, or even better if they could say playing ball, or Buddy Bear is playing ball. Just depends on the level of the child, right? You turn it, see, they fall out sometimes. What is Buddy Bear eating? Eating cookie. Many kiddos struggle with the correct articulation of the sound, or the letter R. Part of that is because R occurs in so many different contexts in English. I love the entire world of R playing cards, or the entire world of R program, because they separated the different types of R sounds. But some different ideas are go fish. They're cards that have the name and the picture on it, so if the child isn't reading yet, they can still use the pictures. Or memory, it's a really fun one, so you can turn the cards over. You have to make sure that you have the right pairs, and then they have to go through and find which cards. And then of course, when they turn it over, they have to say the name. So in this case, they're targeting the sound at the ends of words. So in the final position, this word is newspaper. Some people don't realize that speech and language pathologists work with children who have what's called expressive language difficulties, meaning difficulty with the spoken aspects of our language, how we communicate using our words, versus how well we're understanding the words that are being said to us. And that's not the same as hearing. Hearing would be, okay, does your child turn and look when there's a really loud noise? Does your child turn and look when an airplane flies overhead? that's hearing versus receptive language, meaning they're hearing the words, but then they're also understanding the words that are being said to them. So I have some different cards here. They're color coordinated, and maybe I would, have the child put the locks in the box, right? So it's a little picture of locks. The child has to figure out, oh, where do I go? I can put it in here. To make it more simple, I can remove items from the child's access and from their view and have it just be one thing. So I could say, put the locks under the box. Where would that be, right? So if you are working on following directions with the kiddo and you're targeting words like in, on, under, and perhaps they're not super motivated by little cards like this, what you can do is use something a little more fun. So all I have is a little set of wind-up toys here. So maybe this time I ask the child, okay, put the dog on top of the box. He or she puts it here. Once they follow the direction and they get it right, then we get to turn it on. So it reinforces and makes it fun. For those of you who have kiddos who have a childhood apraxia of speech diagnosis, you're likely familiar with the name Kaufman. There are either it was the assessment that was done with your child when they were diagnosed with apraxia, or the treatment tools that are being used with the family and the child. But I just wanted to introduce some of it in case you're unfamiliar. What your speech and language pathologist is doing is taking different, what are called syllable structures. So the word banana has 3 syllables. And then within that, you have consonants like T, D, M, N, O, P, all those, and then vowels, A, E, I, O, U. What the speech therapist is doing is trying to help your child be able to transition easily between consonant sounds and vowel sounds, and in a diverse number of ways. Other than Kaufman is something called prompt, which is a technique that you have to be trained and certified in as a speech and language pathologist, where you can then use your hand to touch the child's face in a variety of ways. What are called tactile, so touch cues to the face for prompt, P-R-O-M-P-T, are different from the Kaufman. That doesn't mean that one is necessarily better than the other. There is some overlap, but what's nice, and just so that you're aware, if you do have a speech and language pathologist who is using the Kaufman, there are pictures within this book that illustrate some of the ways that you can use tactile cueing. So as far as I know, with the Kaufman, you do not have to have taken the training if you're a speech and language pathologist in order to do this tactile cueing to the face. So I wanted to talk to you a little bit about one of my favorite books and different ways you can use this book for kiddos, either with speech and language delays or autism. One of the main ways that I like to use this book is to try to assist children in learning how to shake their head for no, or to say the word no, or what a speech and language pathologist would call an approximation of a word. So that would be something like nah or oh. So it's not the entire word, but it's pretty close. It's an approximation. I would sit across from them, or either at the table or on the floor. We would open the book, right? Start going through it. Be very excited and animated. You know, that spot. He hasn't eaten his supper. Where can he be? Is he behind the door? And then oftentimes kiddos are interested in that. They want to turn the page. And then we would say, no. And as I'm doing that, I'm shaking the book back and forth, in addition to shaking my head back and forth and saying the word no. And then they would get to take a little time with the bear, because that's the first one in the book. So then they get to play with the bear for a little bit. We bring the bear back, right? Turn the page. Is he inside the clock? No. Right? And then the child would get to have a moment with the snake. I've seen this be really helpful for kiddos as they're trying to learn, that word. And then wait until they're saying that at home. Then you'll be really excited. All right.